Hi, I'm Stephanie Brooks, an equine veterinarian, and today I will be talking to you about Equine Herpes Virus 1, a very common and important cause of cold symptoms in horses. There are currently 7 recognised herpes viruses that can infect horses, 5 of which, being EHV 1 to 5, are natural pathogens. Of these, infection with EHV1 has received the most attention due to its diverse clinical presentations with the potential for high economic and emotional impact. Therefore, this video will be focusing on EHV1. Starting with the clinical presentations of EHV1. Many horses infected with EHV1 are subclinical, meaning the horses remain healthy, while others develop disease of varying severity, which can present as respiratory disease, neonatal disease, abortion, or neurologic disease. This video will focus on the respiratory manifestation of the disease. The clinical signs of respiratory disease include discharge from the nose and sometimes eyes, fever, enlarged lymph nodes, depressed mentation, and they go off their feed. Uncommonly, they also develop a cough. They then develop a second peak of fever, at which point the nasal discharge changes from watery to pus-like. They may develop severe respiratory disease as well, due to secondary bacterial infections. The clinical signs, if uncomplicated, usually subside within 2 weeks. However, they can have prolonged poor performance after apparent recovery. Now moving on to the development and life cycle of the virus. EHV1 infection occurs through inhalation of the infectious virus. Common sources include nasal secretions of actively infected horses, particularly younger horses, fetal and placental tissues, or fomites, which are objects that become contaminated with the infectious virus. These can include shoes, clothing, equipment, feed and water buckets, or troughs. Initially, the EHV1 infects the cells that line the nasal cavity and the throat of the horse. This results in damage and death to these cells, which predisposes horses to infection with other pathogens. During this stage, the virus is shed in the nasal secretions of the infected horse. They start shedding at day 1 post-infection, and most shed for 1 week. They may, however, continue to shed for up to 3 weeks. Shedding later in the process is intermittent, meaning that nasal swabs may test negative for EHV1, despite the fact that the horse is still shedding. Infection rates can be up to 100% in susceptible in-contact animals, meaning it's a highly infectious virus. The incubation period for primary respiratory disease is short, being 1 to 3 days, and fever is one of the most consistent first clinical signs. An important feature of EHV1 is its ability to establish latency. Latently infected cells are not recognized by the immune system, so they provide hiding places for the virus to persist. These horses remain healthy and cannot be identified using standard diagnostic testing, nor can they pass the virus to other horses. Under appropriate conditions, the latent virus can be reactivated and cause infection again. Horses can undergo several cycles of latency and reactivation, and it may or may not be accompanied by clinical disease. So how do we diagnose this? Starting with laboratory tests, you can do post-mortem examination where gross and microscopic lesions are detected. You can grow the virus in a laboratory called virus isolation, or by molecular tests known as PCR. You can also detect the virus-specific antibodies in blood, which is known as serology. However, as the vaccination also generates antibodies, this requires a demonstration of at least a 4-fold rise in the levels of EHV1 specific antibodies between 2 samples collected 2 to 4 weeks apart. In detection of healthy, latently infected animals, it is difficult. This is because there is no shedding of the infectious virus, or the number of latently infected cells may be low or not easily accessible. For diagnosis of actively infected horses with respiratory disease, it is best to collect nasal or nasopharyngeal swabs from several horses in early stages of the disease, as well as from the healthy horses on the property, and test these samples for the presence of several respiratory pathogens. Now moving on to how we treat this. In uncomplicated respiratory disease, it usually does not require treatment. Affected horses, though, should be rested and not return to training until well after full resolution of clinical disease. However, if secondary respiratory infections occur, horses can be treated with appropriate antimicrobials and anti-inflammatory medications. An important part of EHV1 is the prevention and control. starting with a reduction in the risk of introduction of the virus from external sources. New arrivals should be quarantined for at least 3 weeks, including horses returning from travel. These horses should be handled by a designated staff or last each day and should use separate gear. Control of human traffic and appropriate cleaning and disinfection of fomites is also important. Sources of infection can be both newly introduced horses as well as resident horses experiencing reactivation of latent infection, meaning that outbreaks can still happen even in a closed group of horses. The risk of reactivation is believed to be linked to stress. Management practices that minimize stress are likely to minimize the chance of the virus reactivating. These include good nutrition, small stable groups with established social structure, access to good quality pasture and free access to water, competent handlers, control of parasites, and minimizing transport and relocation. So how do we reduce the spread of virus between horses? You can separate horses into small, separately managed groups and use separate handlers and equipment for these different groups. Horses at higher risk of EHV1 should also be kept separate from pregnant and nursing mares. Routine cleaning and disinfection of surfaces and equipment is also important, as EHV1 does not survive well outside of the host, so is easily killed by treatment with detergents, lipid solvents, heat, and common disinfectants. Frequent hand washing, especially between handling different groups of horses, and control of people and horse traffic is important. In an outbreak situation, early diagnosis and separation of infectious horses limits the spread of disease. Rectal temperature should be monitored in all infected and in-contact horses. Contaminated pasture and dirt cannot be effectively disinfected, so horses should be kept away from contaminated areas for 3 weeks. I hope that's been a helpful summary for you about the respiratory conditions involved in equine herpes virus 1.